Hello, we are Group 8. My name is Stacy,
My name is Libby.
and we also have Janie and Jasmine in our group, but they are not here. They are working hard on our PowerPoint and handout, and we thank them for that.
Yes, we do. Our topic is called Special Vitamin Needs in Older Adults. Most of us take vitamins all the time, so we want to learn about if you have to take more as you get older, if you have to take less. So we're going to tell you.
Yeah. And we'll be talking about water and fat-soluble vitamins. Water-soluble vitamins that we'll be going over are B1, 2, 6, 12, folate, and niacin. And the fat-soluble vitamins are A, D, E, and K. The first vitamin we're going to talk about, as discussed earlier, is B1. Ooh. So B1, this is, as you know, a water-soluble vitamin. It's also known as thiamine. It is required by our bodies to properly use carbohydrates and is used to treat digestive problems, metabolic disorders, and many other conditions. Sources of B1 can be found in yeast, cereal grains, beans, nuts, and meat, which we don't have. It's also found in many B vitamin complex products, just because a lot of B vitamins come together, and is offered in supplements orally and by injections. The RDA for this B1 vitamin, it doesn't change with age. So in men, it's 1.2 milligrams per day, and in women, it's 1.1 milligrams per day. And the changes in need due to specific conditions would really be with a deficiency and to reduce the risk of cataracts. So you just want to make sure that you get your B1 so you can see and so you don't become deficient.
Pretty much. Okay, the next water-soluble vitamin that we are going to talk about is B2, which is also known as riboflavin, and it's used in combination with other B vitamins in the B complex supplements.
Yes.
It is required for the proper development and function of the skin, the lining of your digestive tract, and blood cells, and many other parts of the body. So it has a lot to do with the linings. It is found in milk, and meat, and eggs, and nuts, and then also in enriched and fortified flour, and in green vegetables as well. And it is offered in oral supplements with the B complex products. For the RDA does not change with age, so elderly men and all men take 1.3 milligrams per day is the RDA, and for women it is 1.1 milligrams per day. And for changes in need to specific conditions, for adults with deficiencies, they would take more, and B2 can also help prevent migraines and cataracts as well. So that's
Okay, so the third vitamin we're going to talk about is B6. It is a water-soluble vitamin, of course. It helps the body to make antibodies, maintain normal nerve function, make hemoglobin, break down proteins, and keep blood sugar in normal ranges. So kind of a big deal. It's found in avocado, bananas, legumes, meat, nuts, poultry, and whole grains. B6 deficiency is not common in the U.S., so there's not many supplements offered. The RDA for men, this is young men, so it actually changes as you get older. For young men is 1.3 milligrams per day. For women is 1.1 milligrams per day, and then as you age, men need 1.7 milligrams per day, and women need 1.5. So it goes up a little bit, but that little bit probably counts. And then, of course, the RDA would go up. You would need more if you were deficient or if you had kidney stones or macular degeneration.
Okay, so the fourth water-soluble vitamin that we're going to talk about is B12. B12 is water-soluble, so it is excreted throughout the urine, but this is the one water-soluble vitamin that the body can store in the liver 4 years.
What?
Yeah, so it's a little special. It is important for metabolism, and it helps the formation of red blood cells, and it aids in the maintenance of the CNS, the central nervous system. So sources of the vitamin, it is found in a wide variety of animal foods, but it's not typically found in plant food unless it's fortified or enriched. So things like all kinds of meats and eggs and cheese and all that good kind of stuff is where you find B12. Supplemental B12 is found in pretty much all multivitamins, or you can have a prescription for an injection or a nasal gel, or a form that dissolves under your tongue of a B12 supplement also.
I wonder what that would taste like.
I wonder. So, the RDA stays the same for males and females, but however, 10 to 30% of the elderly do not absorb the B12 good as well as they did when they were younger. So they recommend to focus on eating more foods of B12 and not necessarily taking supplements. But if you do take supplements, it recommends 25 to 100 micrograms per day in the elderly to maintain. You take more so that way you can maintain the same levels. And for specific conditions, for adults with a deficiency or preventing macular degeneration or anemia, those are all things that B12 can help with also.
Okay, so the fifth water-soluble vitamin that we're going to talk about is folate. Folate is also called, well, a form of folate is folic acid. It's needed in our bodies to make DNA, genetic materials, and is needed for cells to divide. Makes sense. Sources of this vitamin is found in many foods, such as spinach, oranges, nuts, bread, and beans. And of course, multivitamins, which you can find it in there, no problem. And the RDA for folate is 400 micrograms per day for men and women. And then it's needed for specific conditions such as neural tube defects, heart disease, stroke, and actually decreases the risk of cancer and increases cognitive function. And there's actually a study done that studied elderly people, ages 50 to 70. They were supplemented with folic acid for 3 years. And their cognitive function was studied because apparently as you get older, your cognitive function declines naturally. And also, if you have low folate circulating in your blood, your cognitive function is going to decrease as well. So what they did is they supplemented these 50 to 70-year-old men and women with 800 micrograms per day. And they actually found that their cognitive function increased. So pretty valuable study. Yeah. So there's folate.
Niacin.
Yay!
And niacin is also called nicotinic acid, and it's another B vitamin. It's actually B3, but it typically goes by niacin. So it is used to lower cholesterol and triglycerides in the blood, and it helps lower cardiovascular risk, and that's what a lot of people use it for. So foods that are rich in niacin are chicken, tuna, turkey, and beef, and peanuts. So all those lovely meats and peanuts. You can intake too much niacin when you take supplements, so they do not recommend taking supplements. In fact, per day, they really only recommend taking 14 milligrams of niacin equivalents for women and 16 milligrams of a niacin equivalents for men because they don't want you to take too much. But a lot of people use it for lowering cholesterol. So there's some pros and cons to that. So the pros are that it works very well, but when you use it to lower cholesterol, they want you to take 500 plus milligrams. Ooh. And that's a lot. And so then some of the cons is that much niacin can actually cause liver damage and peptic ulcers and skin rashes. And there's a thing called the niacin flush, where it's characterized by redness and itchiness and tingling in your face and your upper chest. And all these cons can begin at doses of 50 milligrams or more, and they want you to take 500 to lower cholesterol. So those are the pros and cons. It works really well to lower cholesterol, but there's a lot of side effects that can come with taking that much niacin. So Vitamin C is also known as ascorbic acid, and it is, again, a water-soluble vitamin, and it is our seventh and final vitamin.
Dun, dun, dun.
Yes.
Water-soluble
and it
vitamin.
is needed for normal development and growth. So this is a pretty big one. It's a powerful antioxidant that maintains connective tissue, your bones, blood vessels, and skin. It has a really big key in collagen synthesis. And a little background on collagen. Collagen is the fibrous proteins that are the base of your skin and your tendons and your cartilage and other connective tissues, so a lot of your body. So some sources of vitamin C are cantaloupe, citrus fruits and juices, kiwi, mango, papaya, red peppers, pineapple, watermelon, and berries are all very good sources. So typically there's a low risk.
You're doing great. Keep going.
Of overdosing on vitamin C when it's consumed through food and supplements. But there are some rare side effects that will pop up if you are overdosing and you are taking too much. So the side effects are nausea, heartburn, vomiting, abdominal cramps, bloating, and a headache. So nothing pleasant. The RDA of vitamin C for elderly men is 90 milligrams per day, and for women it's 75 milligrams per day. In specific conditions, through a metabolic study, they found that elderly people tend to need a higher concentration of vitamin C just to maintain a good plasma concentration. So that's why their RDA is a little higher than regular aged.
Okay, our first fat-soluble vitamin is vitamin A. It's also called retinol. It has many precursors known as carotenoids, and one of the main one is beta-carotene. The vitamin is responsible for many things: growth, vision, reproduction, maintenance of cognitive and immune function. And it also acts as an antioxidant. Sources of vitamin A are found in fruits and vegetables, like sweet potatoes and carrots, among other items. And it can also be found in fortified milk, meat, fish, poultry, and other dairy foods. As people age, vitamin A does not decrease in terms of absorption. They actually probably absorb it better.
Mm-hmm.
But men 51 years and older have an RDA of 900 milligrams per day. Women 51 years and older have an RDA of 700 milligrams per day. And they're actually suggesting that they take 600 as opposed to the 900 and 700 because they absorb it so much better than you or I. Just might be a good idea so they don't have hypervitaminosis. Conditions that can occur when there's not enough vitamin A that is absorbed are hip fractures, believe it or not, cataracts, and macular degeneration. Okay, so our second fat-soluble vitamin is vitamin D. There's two forms of vitamin D, D2 and D3. D2 is manufactured and used to fortify foods. D3 is found in food naturally. Now, you can absorb vitamin D through your skin or through foods. And what happens in this process is, at least in the skin, sun hits your skin and it turns into pre-vitamin D3. It's then bound to binding protein and released into circulating blood. Goes to the liver, well, it's hydroxylated, and then goes to the kidneys and other tissues where it's utilized. Kind of cool. Same thing happens when you eat fortified foods or whatever it may be, except, of course, you don't have the skin components. Vitamin D plays an important role in calcium phosphorus balance, which is basically bone support. However, there's many studies being done to see what else it does. Vitamin D is thought to decrease chronic pain, increase mood, maintain physical function and motility, decrease risk of cancer, diabetes, cardiovascular disease, and many other things that, again, are being studied. The sources of vitamin D are deep sea fish, like salmon, herring, sardines, mackerel, and wild mushrooms. Fortified milk and orange juice and fortified cereals, of course, have vitamin D in them. But sun really accounts for 80 to 100% of the vitamin content that we absorb. The RDA is 400 micrograms per day. Now they're suggesting, and that's for adults 51 to 70 years of age. If you're over 70, they're suggesting that you take 600, and that's simply because as an older adult, you don't get as much sun exposure. And also, you absorb about a quarter less of what we would absorb.
Makes sense.
As young adults. So, and they also have decreased skin synthesis, so
They can't.
That's why they're thinking that they want more than 400. Deficiencies that can be caused by vitamin D is muscle weakness, hypertension, type 2 diabetes, metabolic syndrome, cancer, overall impaired health, or even death. And again, all of these things are being studied, so it's kind of the mystery vitamin for now.
So our third fat-soluble vitamin that we are going to talk about is vitamin E. Vitamin E is also known as tocopherol, and it is fat-soluble, and it acts as an antioxidant in the body. It protects our cells from damage, and it boosts our immune system and fights off bacterial and viral infections. So it's found in seeds, nuts, and vegetable oils, along with green leafy vegetables and cereals that are fortified. So far, all of the supplemental trials that they have done with vitamin E have had negative results, and there's really no evidence that absorption of vitamin E goes down with age. So at this point, they don't really recommend a higher dosage for the elderly. The recommendation is 15 milligrams a day, and you have to make sure that you're also intaking a healthy amount of fat, since it's a fat-soluble vitamin. So you have to have a healthy intake of fat for it to be able to be absorbed. And there's no changes for any specific conditions that we were able to find.
So, vitamin K is known for its blood clotting abilities. It helps the blood clot and prevent extreme bleeding. Vitamin K is rich in mostly leafy green vegetables, such as spinach, kale, and broccoli. Vitamin K1 and K2 are recommended for supplementation, which is interesting. The intake with aging is not an issue for vitamin K, except if you're on blood thinning medications like Coumadin. You're going to want to be aware of your intake of dark leafy green vegetables. The AI is 90 micrograms per day for women and 120 micrograms per day for men. Vitamin K is used for blood clotting. It's applied to the skin for spider veins, bruises, stretch marks, and after surgery or injuries. And it is also used to speed up the healing of skin. In conclusion, the RDA as you age of these vitamins may go up or down. A goes down, for example.
It does. It does.
So it goes up or down depending on the vitamin, the personal situation, chronic conditions, etc. Thank you for watching. We hope you learned a lot.